Hello and welcome to this week's Wellbeing series. Today we're doing Understanding Memory Loss, and joining us is Danielle from the Alzheimer's Society in Oxford. Welcome, Danielle.
Thank you. So as she said, my name is Danielle Bialis. I'm the public education coordinator for one of the public education coordinators for the Alzheimer's Society Southwest Partners. We used to be the Alzheimer's Society of Oxford, but we've joined with Middlesex and Elgin, so we are the Southwest Partners now. And I'm going to share my screen and we'll get started. And I'm just going to move you guys over this way here. Okay. So dementia in Canada at a glance. Over 500,000 is the number of Canadians living with dementia today. 912,000 is the number of Canadians living with dementia by 2030. 76,000 is the number of Canadians diagnosed with dementia every year. 65% of those diagnosed with dementia over the age of 65 are women. 1 in 5 Canadians have experienced caring for someone living with dementia. So in Oxford County, in the year 2014, so these are fairly old stats, so it could be much higher. But in our population over 65, there's 19,150 people, and 1,959 of them have dementia. So in 2036, that more than doubles. So history tells us only about 1/3 of the population actually seeks a diagnosis. So the true number of those impacted in Oxford County this year and following years could be potentially much greater. So nationally, women represent 72% of all Canadians with Alzheimer's disease. 72% refers to the average percent for Canada, which is derived from the percentage of women in all of the provinces and territories. The main risk factor for dementia is age, and women are doubly affected by Alzheimer's disease, mostly due to the fact that women live longer than men do often, and so they also make up a lot of the family caregivers. So what is dementia? Dementia is an umbrella term. So there are more than 100 forms of dementia. There are reversible causes, which are in the blue here, and then there are irreversible ones that are in red. So dementia is not considered a normal part of aging. So these are all types of reversible dementias: depression, medications, nutritional deficiencies, metabolic disorders. So these are the things we want to rule out before we go looking for a diagnosis of dementia. So types of irreversible dementia include Alzheimer's disease, vascular dementia, Lewy body dementia, frontal temporal dementia, and young onset dementia. So I'm just going to give a little bit of detail about all of those. So Alzheimer's disease accounts for 65% of all dementias. Plaques and tangles in the brain and age is the biggest risk factor of Alzheimer's disease. So plaques and tangles occur in the brain due to toxic proteins, and they're called beta amyloid and tau. So vascular dementia is up to 20% of all, makes up to 20% of all dementias. It can be caused by a stroke, and risk factors include age, smoking, and high blood pressure. Lewy body dementia is prevalent of 5 to 15% of all dementias. So areas of the brain most affected are movement and thought. Risk factors are unknown, and it seems to be more common in men. It's caused by deposits of protein called Lewy bodies in the brain. So frontal temporal dementia only makes up about 2% of all dementias. It tends to occur in people at a younger age, and it affects areas of the brain responsible for personality and behavior. You also can often hear it referred to as FTD. Another one is young onset dementia. Affects people who are under the age of 65. Many people with early onset are in their 40s and 50s. Doctors don't really know why most cases of early onset Alzheimer's appear at such a young age. But in a few hundred families worldwide, scientists have pinpointed several rare genes that directly cause Alzheimer's. People who inherit these rare genes tend to develop symptoms in their 30s, 40s, and 50s. When Alzheimer's disease is caused by deterministic genes, it is called familial Alzheimer's disease, and many family members in multiple generations are affected. So some things to note. Alzheimer's disease is progressive. Damage from the disease increases over time. It's degenerative, so brain cells degenerate or break down, and it's irreversible. Damage cannot be repaired. At present time, there is no known cure. Although the onset is gradual, Alzheimer's disease eventually affects all aspects of a person's life, including mental abilities, emotions and moods, behavior, and the ability to carry out daily activities like eating and grooming. So know the 10 warning signs of Alzheimer's disease. Memory loss that disrupts daily life may be a symptom of Alzheimer's disease or another dementia. Alzheimer's is a brain disease that causes a slow decline in memory, thinking, and reasoning skills. There are 10 warning signs and symptoms. Every individual may experience one or more of these signs in different degrees. If you happen to notice any of them, please see a doctor. So the first one is memory loss that affects day-to-day abilities. Forgetting things often or struggling to retain information. Difficulty performing familiar tasks, forgetting how to do something you have been doing your whole life, such as preparing a meal or getting dressed. Problems with language, forgetting words or substituting words that don't fit the context. Disorientation in time and space, not knowing what day of the week it is or getting lost in a familiar place. Impaired judgment, not recognizing a medical problem that needs attention or wearing light clothing on a cold day. Problems with abstract thinking, so having difficulty balancing a checkbook, for example, or not understanding what numbers are and how they are used. So in this picture, it's showing a lady that's put her dress in the fridge, so misplacing things, putting things in strange places, like the dress in the refrigerator or a wristwatch in the sugar bowl. Change in mood and behavior, exhibiting severe mood swings from being easygoing to quick-tempered. Changes in personality, so behaving out of character, such as becoming confused, suspicious, or fearful. Loss of initiative, so losing interest in friends, family, and favorite activities, not wanting to do much or go out. So the progression of Alzheimer's disease. It's important to remember that the disease affects each person differently. The order in which the symptoms appear and the length of each stage will vary from person to person. There may also be fluctuations in a person's functioning from day to day. So in the early stage, a person in the early stage may have an awareness of changes in their abilities. They may stay involved in activities or become passive or withdrawn. Often, the earliest sign of Alzheimer's disease is the loss of short-term memory. This is not the usual forgetfulness that happens to us all occasionally, but continual short-term memory loss of things such as recent events or conversations. Difficulty remembering the right word or mixing up words may make communication more difficult. So middle stage. As the disease progresses, a person's mental and physical abilities will decline further. Memory becomes increasingly impaired, and the person may lose awareness of their own personal history. Moods and emotions may begin to change, and misinterpretations may cause the person to become frustrated. Increased confusion and disorientation to time and place will result in the person requiring assistance in many daily tasks, such as dressing, bathing, etc. In the late stage of dementia, the person will not remember how to do things they have done all their life. There is often significant impairment to judgment, and the ability to express emotions may be impaired. The person will have more difficulty understanding what others are saying to them and expressing themselves so that others understand. Conversation may be limited to only a few words, or the person may be unable to speak at all. The person will no longer be able to complete the activities of daily living unassisted. I have a short video, but here's